I'm Dr. Mudit Khanna, consultant in the Department of Orthopedics and Trauma at Wockhardt Hospitals, South Mumbai. My primary area of interest and specialization is in the field of joint replacement surgery around the knee, around the hip and around the shoulder. Today we'll be talking about a lovely 60-year-old lady who came to us all the way from New Zealand. She presented to us with severe degree of pain in both her hip and the knee that has been present for many years and was significantly interfering with her activities of daily living and significantly compromising on her quality of life. The challenge, however, was that she weighed about 130 kgs and had a BMI of 47. We did brief her about, she had already undergone a hip replacement and a knee replacement surgery on the opposite side about more than 10 years ago. When she came to us, we took a detailed history, did a thorough examination, investigated her, and we realized that she needed both a total hip replacement and a total knee replacement for the way her hip and knee were affected. She was very keen on having both the procedures done during the same visit to us. The way we planned it out, therefore, was to have a hip replacement first, look at how she recovers from the procedure, whether she's able to deal with the stress of the surgery, the blood loss, etc. that comes with the procedure, and then if she was doing fine with it, then go ahead with a knee replacement after a few days. This is an X-ray of her affected or left hip joint. What we see here is the thigh bone or the femur. This is the neck of the femur, and the neck of the femur should go into a round ball. Now what we see here is that the ball is not round anymore. In fact, it is almost completely flattened out, and this flattened out ball has also eaten up the socket. What we need to do now is to replace her hip joint and give her a normal ball and socket joint. This is her X-ray after the procedure. Now as we can see here, the socket has been repositioned at the right place and we can see a round ball at the back. Now this allows the ball and socket to move in the right way, reducing her pain and giving her the mobility that she needs. The way we can see it here, this is the stem that looks like this, which has actually gone into her femur bone like this. That's the ball around it. And then the socket is placed into the pelvic bone or the acetabulum to give her the socket and thereby completing the ball and the socket joint. She made a steady recovery. She was walking the same evening of surgery with the help of a walker. She was sitting at the edge of the bed for all her meals, and therefore we gave her a couple of days. We said, let's see how it goes, and the plan was to go ahead with a knee replacement surgery after 2 days. Now when we look at her knee, essentially her right knee, which was giving her trouble, we can see that this is the lower end of the thigh bone, this is the upper end of the shin bone or the tibia, and between the thigh bone and the shin bone there should be a reasonable amount of gap. However, what we can see is that the bone at the top is rubbing against the bone at the bottom here. There is no space. She essentially has bone on bone arthritis on her right knee. This is her X-ray after the surgery, the lateral view. Now as we can see, after the knee replacement surgery, all the osteophytes or the extra bone formation that was right here has been taken care of. It has been removed. The bone is not rubbing against the bone, and the loose bodies or osteophytes that were present at the back of the knee have also been removed. She is now able to extend the knee fully and bend the knee reasonably well. As per plan, we had no unexpected events during the surgery. She made a steady recovery with the knee replacement as well. She was up and about the same day in the evening after the replacement surgery, did very well with the physiotherapy regimen, and complied with all the requirements that the physiotherapist posed in front of her.
Absolutely a good decision to come to Wockhardt Hospital and actually to meet Dr. Mudit Khanna. I would not have changed anything. I feel a lot more confident even after the first day after operation. So I've got a lot of plans about doing cooking, stuff that I couldn't do before, cooking, swimming, can't wait to get back to swimming, walking just to be able to, because I used to love walking. So excited, it's like the whole world is just, here we go.
She's able to take quite a few steps without the help of a walker, holding somebody's hand, as she was sharing her experiences with our team here. She's all set to fly back to New Zealand in the next couple of days.